for joining me to hear from FAAN member neurologists and their patients about the value of the physician-patient partnership in neurologic care. I'm Orly Avitzur, president of the American Academy of Neurology. Today we're having a conversation about brain health and epilepsy with Dr. Joseph Servin and Michael McKenna. Along with being Michael's physician, Dr. Servin is professor of neurology at the Mayo Clinic and editor of Brain and Life in Espanol, the patient and caregiver magazine for Spanish-speaking readers. Michael is living with epilepsy. Welcome to you both. I'm going to start by asking you, Joe, to introduce yourself.
Sure. My name is Dr. Joseph Servin. I am a neurologist at the Mayo Clinic. I'm actually based in Jacksonville, Florida, but I met Michael when I was at another Mayo Clinic site in Phoenix, Arizona, and my practice is in the world of adult epilepsy.
Michael, I'd love to hear your story. Would you share it with us?
Yes. So my name is Michael McKenna, and I've been living with epilepsy for over 25 and a half years. I met Dr. Servin about 16 years ago, and I've been living with the RNS system for close to 13, just over 13 years.
Thank you very much. And Michael, maybe you can start us off at the beginning. When did you first recognize that there was something wrong?
I first recognized there was something wrong waking up in the ER room, like unexpectedly, like, why am I here? And I was told that I had a fall out of the shower, fractured my skull the way I landed, fractured my neck, and was told that I had an episode. And I didn't know what that meant. And I ended up into the world of trying to figure out what was happening to me. So it was unexpected.
How old were you at the time?
I was 30.
And so over the course of the next year or so, how many further spells did you have?
Early on, they were happening about every 3 to 4 months. And the word epilepsy never really came into the conversation yet. My doctors were thinking, maybe it's something with my heart. Like, was I having a vasovagal episode? So the concentration was really on my heart. So I was still working, never even researched what epilepsy was, until I had an auto crash and I woke up in the ER again, and I was told I had a seizure and I couldn't drive anymore. And I was like, seizures? Like, what's that? And so then that just changed my whole life again, right there.
Dr. Servin, I was wondering what it was like for you to meet Michael and what happened in the first few years of treatment and diagnosis after your initial meeting.
Sure. Well, one of the things that struck me with Michael is that he was very determined. He was someone who wanted to get his life back on track and was really suffering from all the consequences. Now, I did go down the conventional route. We had to do things such as epilepsy monitoring. That means putting in the, admitting someone to a video EEG unit where we record seizures and try to understand what's going on. So that helped us. But eventually we got what we needed, and we got to a place that we were hoping to be able to do surgery. But at the end, we had to do a step beyond, which was do an operation for the sake of doing a curative operation. That is, putting electrodes on the brain, EEG strips on the brain, so that we could record directly. We did that. So ultimately, we offered a new treatment, a device that was very early in its days, something called RNS, or responsive neurostimulation. This was like a device, almost like a pacemaker implanted in the brain, connected to EEG. It picks up seizures like a mini EEG machine, and it also sends targeted electrical stimulation when it detects a seizure. It was very new wave, very newfangled. We hoped that it would work, but we didn't know, to be blunt. We were so early. And that should give you a sense about Michael, and certainly gave me the sense. he was determined, because that's pretty gutsy, but that just gives you a sense of just the complexity of his journey. That was by no means guaranteed.
So, Michael, what year was it that you received the device, and how did your life change after that?
I received the device in 2008, so quite a while ago. And so I just went forward, and together with Dr. Servin, we just kind of like put all the pieces together and found things that worked for me. And I mean, it was just amazing. That was a change in my life, was going into that research study. And so I've been seizure free now about 9.5 years. I still take medication, one medication. I still have the RNS device, providing my therapy. But I live a normal life today. I work full time. I get to help patients living with epilepsy today, every single day. And so today I feel like I give a purpose for what I went through all those years, being able to give back with empathetic care today. So thank you for asking.
Thank you both very, very much. I appreciate you both sharing your tale spanning more than 20 years.